Hello everyone, today I'm going to show you how we wash our hands before going for a surgery. Before hand washing, always ensure you are not wearing any jewelry, example rings, watch or bangles. Next is ensure your nails are short, clean and without nail paint. Wear a surgical cap covering all hairs and ears. Properly wear your surgical mask covering both your nose and mouth. The sleeves of your scrub suit should be tucked in properly and should not touch your elbows. For hand washing, you can either use Betadine or chlorhexidine wash. Each step should have 10 to 15 strokes. The whole process is of 3 to 5 minutes. So now you will take 3 to 5 pumps of hand wash and start hand washing. First step is palm to palm. Second is right palm over left dorsum and vice versa. Third is finger interlocking. Next is rotational rubbing of thumb. Next, rotational rubbing of fingertips. Next is wash wrist and forearms. Continue scrubbing each wrist and move upward towards the elbow. Each movement should be in one direction only. Don't move back once an area is cleaned. Scrub at least 2 inches above the elbow thoroughly. Then rinse hands and forearms. Keep in mind, don't touch the sink, tap or any surrounding surface. Keep hands above the level of elbows. And now you can move to surgical area.